झालं का ग?
Good afternoon, all. Am I audible?
Good afternoon. Good afternoon.
Yes.
Good afternoon.
So, welcome to all on behalf of Maharashtra University of Health Sciences, Nashik. I am Dr. Kalvi Gitanjali, Professor and Head Ayush Department. And today, we all are here to discuss a case on skin disease. Since last meeting, we have started skin disorders. And our first case was psoriasis. And again, our second case is also on psoriasis because it is a critical and chronic disorder. So we are going to discuss more and more cases. So second case on psoriasis. And today we have Dr. Shraddha Satre from Siddhakala Ayurved College, Sangamner. She is a PG scholar. And our expert team is Dr. Bhushan Telure sir. Dr. Bhushan sir.
Yes, ma'am.
Okay, sir. Then Dr. Bhushan is assistant professor from Department of Dermatology and he is from Dr. Vasantrao Pawar Medical College, Adgaon, Nashik. Others, please mute yourself and please do not disturb us. Okay. So next expert is from Ayurveda, Dr. Sandeep Mane. Dr. Sandeep Mane, you there? Okay, he will be with us within few minutes. Then our third expert is from Homeopathic, Dr. Vaibhav Mahajan. He is professor and head of Department of Communication from Dhanvantari Medical. Arnika Singh, mute yourself. Thank you. So, first we will start from our today's case, psoriasis. Shraddha, you may share your screen. Dr. Shraddha Satre, PG scholar from Siddhakala Ayurved College, Sangamner. Dr. Shraddha.
आता काय करायचं काय लिहायचंय
ये विजी बॉस
कम्प्युटर तुम्ही काय नावाने जॉईन झालेले आहात डॉक्टर श्रद्धा? कम्प्युटर डिपार्टमेंट श्रद्धा सत्रे जे आहेत त्यांना को-होस्ट करा. श्रद्धा सत्रे को-होस्ट करा, म्हणजे ते आपल्याला स्क्रीन शेअर करते.
मॅडम ऑलरेडी ते कोस्ट आहेत, तुम्ही त्यांना हे स्क्रीन शेअर करा सांगा.
श्रद्धा करू का? इथे खाली एक ग्रीन टॅब दिसतोय. आधी तुझी पीपीटी जी आहे ते ओपन कर आणि त्यानंतर शेअर म्हणून. पीपीटी ओपन आहे का तुझ्या कम्प्युटरवर? होस्ट इज नॉट अलाउइंग टू अनम्यूट. धेंडे सर काय प्रॉब्लेम आहे?
मॅडम ते कुठल्या नावाने जॉईन झाले तिथं सापडत नाहीये.
श्रद्धा सत्रे.
SAP.
SH सापडलं?
नाही सापडत नाही. सप्रे नाव नाहीये त्याच्यामध्ये.
श्रद्धा सत्रे मला सापडलीये. मी आहे का को-होस्ट?
हा, तुम्ही त्यांना कोस्ट करा.
Ask to start video. Ask to unmute. नाही ना सर, मलाही ऑप्शन नाहीये.
येस मॅम.
झालं. ओके ओके.
हा, सत्रे आहे, त्यांना कोस्ट करतो मी.
येस सर.
हा, केलंय.
थँक्यू. सो श्रद्धा, प्लीज शेअर युअर पीपीटी.
हा मॅडम, बोला आता.
येस मॅम.
हा, बोला मॅडम.
First, put your PPT on your desktop and then
Ma'am, is it visible?
no. Again, click to share button. There is your PPT open on your desktop?
Yes ma'am.
Then click to share. Click to share.
Yes ma'am. Now is it visible?
No, not yet. Yeah, your screen sharing is started. Okay, it is visible. Yeah, please tap. Please unmute yourself, Shraddha. धेंडे सर, त्यांना अनम्यूट करता का परत? ते म्यूट झालेत आपल्याकडनं.
Hello.
Yes.
Am I audible?
Yes.
दोनों हाथ ऊपर.
Start करा.
My PPT visible now?
Yes, your PPT is visible. You are audible. You may start. Yeah.
Good evening, respected teachers and all my dear friends. Myself, Dr. Shraddha Satre from Kaya Chikitsa Department of Siddhakala Ayurved Mahavidyalaya. We are here for the presentation of psoriasis, a case study. First of all, psoriasis is a chronic disorder and it is a non-contagious autoimmune disease that causes the rash of red scaly patches and silvery scale on the body, which is commonly present on the knees, elbows, scalp, trunk. It is also a long-term condition with no cure.
Shraddha, your
It
slides
can
are...
Hello.
Your slides
Hello,
are
ma'am.
not moving. Your slides are not moving. Please take help from somebody.
मॅडम प्रेझेंटर मोडला ते ऑन हे करा, शिफ्ट करा आणि मग चेंज करा स्लाइड्स. प्रेझेंटर मोडला टाका.
खाली जे आहे ना,
खाली बघा 75 जिथे आहे ना, 75% च्या शेजारी जो आयकॉन आहे ना त्याच्यावर क्लिक करा.
Okay.
বলো এই মনেরই আরতি আমার এই যাত না দেখে
जिंदगी सच पर है सुहाना
मला असं वाटतं ज्यांना गरज नाहीये त्यांनी ही मीटिंग लिव्ह करायला
नाही मॅम मी वेटिंग रूम ऑन करतोय, यांना रिमूव्ह करून टाकतो पार्टिसिपंटला.
येस येस ओके
Ma'am, now is it removing?
करा ज्यांच्याकडनं हे होतंय.
Hello. Now
Yes.
is it moving?
नॉट येट. हा होतंय बोला.
Hello.
वाच झालंय. हलतायत स्लाइड्स आता.
Okay. So psoriasis is a chronic non-contagious autoimmune disease that causes the rash of red scaly patches and silvery scale on the body, commonly on the knees, elbows, calves and trunk. It is a long-term condition and has no cure, but it can be managed through the various treatments to reduce the flares and the symptoms. The common factors that triggers the flares includes the infection, stress and certain medications. The psoriasis prevalence rate in India ranges from 0.44% to 2.8%. Male are twice as likely as female. That is 2.03 is to 1. So the psoriasis is the modern terminology which is correlated with Kitib Kushta in Ayurveda. And the dosh for Kitib Kushta are the three doshas. It involves the impairment of the skin's normal functions like Twak, Rasa, Rakta, Mounts and Lasika. For this case study, we have studied the patient, which is a 22 years old male patient, came to our Siddhakala Ayurved Mahavidyalaya OPD, which was normal before 12 to 13 years, and he developed the small skin lesions over the upper limb, lower limb, scalp, and abdomen, and associated with the severe itching and powdery discharge distributed all over the body. He is student from our college and he has been consulted for the allopathic physicians before consulting to our OPD, and he was advised by the antibiotics, antihistamines and topical steroids, but there was no considerable relief. Later he consulted to our hospital OPD for the same. The chief complaints were Sarvanga Kandu, that is itching all over the body, Twaka Vaivarnya, that is skin discoloration, Sarvanga Mandalutpatti, circular patches all over the body, Twaka Rukshata, skin dryness, Twaka Pradeshi Daha, that is burning sensation at the skin region, Kesh Patan, that is hair fall, Darunak, dandruff, Daurbalya, weakness, and Anannabhilasha, that is aversion of food. These complaints were from since 12 to 13 years and were increased since 1 to 2 months. So he decided to come to our OPD. We have taken his personal history from that Ahar Praman, that is quantity of diet, that is 2 to 3 rotis, 1 bowl of bhaji, 1 rice, 1 dal, fruit salad, junk foods, pickles, papad, paratha, tea, ghee, dal, pani puri, samosa. These were in regular diet of that student. And ras pradhanya, that is dominant of taste, was katu, that is bitter, madhur, that is sweet. Ahar gun, properties of diets were means the consumption of of that student was predominantly the tikshna, which is the piercing property, guru, heavy, abhishanda, that is oily and greasy, snigdha, unctuous, pishtana, grain food, viruddha ahar sevan, that is incompatible diet. Yes, ma'am.
Shraddha, your slides are not moving.
Ma'am, now is it moving?
No. You have not shared properly. In upper bar, there is slideshow.
Yes, ma'am.
So click. Okay. Now there is slide of diet.
Yes, ma'am.
Okay. And please read only modern terminologies because our participants are from various parties.
Okay, ma'am.
Yeah.
Diet habit was vegetarian. Its routine was normal. Addiction, there was no addiction. Hunger was a loss of appetite. And the thirst was medium. Then Ashtavit Pariksha, that is the pulse was 86 per minute regular, stool was sticky and foul smell, urine was normal, tongue was coated, Shabda means the praying Krishnata, Sparsha was dry and scaly, Druka was reddish conjunctiva, and Akruti is kapha dominant in Ayurveda term. From skin examination, it was ruptured, scaly, thick plaques, Raktavarnita patches, Kandu means itching was present, Daha means burning sensation was present. Dashavit Pariksha according to the Ayurveda. So, ma'am, I have to read this. It's from. Hello? Hello?
Shraddha, please read only modern terminologies.
Okay, ma'am. So, investigations we were done to rule out any other pathology. All the relevant blood investigations, such as CBC, ESR, HIV, was done and it was found to be normal. We have calculated the PASI score, which was 37.5. Koebner phenomenon was positive, and IgE was 142. So, the differential diagnosis for this case was scabies, ictoisis, and ringworm. So, final diagnosis was Kitip Kushta, that is psoriasis. These are the before treatment pictures and after treatment pictures of the student, which are seen to be reduced in this picture. So, ma'am, I will like to hand over to my guide.
Okay. So thank you so much, Shraddha. You have presented your case in detail. So now to discuss this case, we have dermatologist with us, Dr. Bhushan Telure, sir. Sir? Dr. Bhushan? कम्प्युटर डिपार्टमेंट धेंडे सर तिथे भूषण सर म्हणून आहेत आपल्याकडे भूषण तेलुरे त्यांना अनम्यूट करता का
एक मिनिट मॅम एक मिनिट
डॉक्टर भूषण
फक्त भूषण नाव आहे
हा त्यांना हा डॉक्टर भूषण तेलुरे त्यांनी मेसेज टाकलाय
हा आता ते करू शकतात आम्ही
येस ओके
Yes, ma'am.
येस सर
Yes, ma'am. So, clinically, the patient looks like of psoriasis vulgaris itself. But the photos that which were shared before and after do not correlate with the PASI of 37.5. Maybe only selected photos were uploaded, that is why. Otherwise, the presentation was fine. Detailed history was given. And in allopathy, we give an importance to the stress or if there is any addiction that is present in the patient. Because stress plays a major role in development and triggering of psoriasis. So we like to take a detailed personal history of the patient with respect to the routine.
turn on your video
Yes, ma'am.
So-
Sure. Yeah.
okay yeah
So, so depending upon the stress levels of the patient might present with different triggering, different severity of psoriasis. And alcoholism also plays an important role. So I would ask the student to have a detailed history about any addictions that the particular patient has or not.
Shraddha
Hello. I have taken, ma'am. There was no addiction for him.
Okay.
What is etiopathology according to modern medicine, sir?
So the etiopathogenesis, the actual cause or the etiology is unknown, but it is projected that because of there is imbalance between the CD8 cells and the CD4 cells, which are the T cells which are present in the immune system. Because of their imbalance, it results into hyperproliferation or increased formation of the epidermis. And because of that, the normal cycle, which is of 28 days or 28 to 35 days of skin generation, that gets shortened to 3 to 4 days. And that is why we see psoriasis.
Okay. And what are the recommended investigations?
So, investigations can be divided into two parts. One is related to the underlying disease itself, and second is relating to the treatment that we will be going to be offered to the patient. So, for the underlying disease, we usually do skin biopsy. And if the patient is having any joint pain, we do a baseline radiological imaging of that particular joint, because as we all know, psoriasis tends to affect the joints as well. So radiological imaging and routine investigations, that is CBC, liver function test, kidney function tests, and radiological examination. And depending upon the treatment that we are going to plan for the patient,
Absolutely.
apart from the
absolutely.
routine investigations, we also do chest X-ray. Then we can perform this cutaneous TB sensitivity in this patient, because
No, make it
and
this
with
way
the
you
lithotric
want.
jet. So accordingly, we can manage the patient with respect to the modern medicines that are available. So for methotrexate, basic investigations that need to be done include complete blood count, liver function test, kidney function test, and chest X-ray.
Okay, sir. And what about line of treatment according to
So for this patient, ma'am, considering his age and PASI of 37.5, I think methotrexate should be the first line of treatment, which is starting dose is 7.5 milligrams once a week, and depending upon the how the patient responds or how well the patient tolerates methotrexate, we can increase the dose, because methotrexate, as we all know, it is an anti-cancer drug. It has its own side effects. So depending upon the patient's acceptability and the side effect profile, or depending upon the dose, or how the patient accepts that, we can increase or decrease the dose accordingly. The treatment usually goes on for 6 to 8 months, in which the patient will have good reduction of the lesions. And for itching, antihistamines can be given. And topically, only liquid paraffin or any kind of emollient, because for a PASI of 37, giving topical steroids will not be a right choice.
Okay, sir.
Hello, sir. Hello, ma'am.
Just
Ma'am,
wait,
we are
wait. Sir, are there side effects or any limitation which you face during your practice?
With respect to treatment or with respect to psoriasis itself?
Anything, sir.
Okay. So with respect to treatment, yes, definitely, because the patient is chronic, long-standing, because the disease itself is chronic, long-standing, as the presenter herself said that there is no cure. So it becomes tedious to manage the patient for a long period of time. And there are periods of remission and periods of relapses. So when the relapses occur, at every time you have to treat the patient accordingly. And with respect to the medications, methotrexate is fairly it's a double-edged sword, I would say, because you have to balance the side effect profile, the dose of the patient, dose of the medications, according to the results that you want to obtain in the patient. So, with respect to methotrexate, there is methotrexate toxicity, which is a huge risk, and the patient might land up in severe complications with hepatic failure, then gastric disturbances, cutaneous ulcers, and that can be life-threatening as well. Apart from methotrexate, there is no other challenge as such to treatment of psoriasis. And newer molecules and newer drugs are available, but methotrexate still is the treatment of choice for psoriasis, because in Indian scenario, it is it is a very affordable medicine, and patient it is very easily available. And if the patient is counseled properly, it can give very good results.
Okay. So Dr. Bhushan is well-known dermatologist in Nashik, working at Dr. Vasantrao Pawar Medical College, Nashik. Thank you so much, sir, for discussing the etiopathogenesis, investigations, treatment, and limitations from modern medicine. Now, please stay with us because
Yes, ma'am.
there are many questions in chat box for you,
Yes.
but we will discuss later. So now, in Ayurveda perspective, to discuss with us, Dr. Sandeep Mane. Yes, Dr. Sandeep Mane. Unmute करा त्यांना. Dhende sir. Dr. Sandeep Mane.
Hello, madam.
So, Dr. Sandeep Mane is here. He is professor and medical superintendent from Praura Rural Ayurvedic College, Loni. Welcome, sir.
Yes. Thank you.
Are you presenting your slides, sir?
Madam, एक मिनट.
Okay.
Share.
So Dr. Sandeep Mane is guide who is guiding to Dr. Shraddha Satre, our PG scholar, today's PG scholar. So it's a student guide combination, and he has actually seen that patient. So we are curious to hear your line of treatment.
Madam, slide दिसते.
नाही सर, अजून नाही दिसत आहे. तुम्ही तुमच्या डेस्कटॉपला ओपन केल्यात सर स्लाइड्स? पीपीटी ओपन
केला
केला?
मॅडम.
मग एकदा परत एकदा शेअर करा म्हणजे होऊन जाईल. वाटलं शेअर एंटायर स्क्रीन म्हणा आणि मग त्यातनं स्लाइड सिलेक्ट करता येतील.
ओके. दिसतंय मॅडम?
नाही सर, अजून नाही. So today there is huge crowd, near about 630 and more participants are there. So welcome crowd, but please do
सर
not.
पीडीएफ तुम्ही ओपन करून ठेवा आणि मग खाली शेअर स्क्रीनला जाऊन ती पीडीएफ वर क्लिक करून मग ती शेअर करा.
ओके.
अगोदर पीडीएफ ओपन करून ठेवा तुम्ही आणि मग झूमच्या शेअरला जाऊन ती पीडीएफ सिलेक्ट करा आणि शेअर वर क्लिक करा.
So there are many teachers also. So I will request to all teachers, if you are treating such kind of different cases, then please send to us. We will discuss in next meetings. Please motivate your students, PG scholars particularly, to send us cases. So we will discuss the rare and the common cases also. Yeah, sir. Okay. Your slides are visible, sir.
Okay, ma'am. So, this is
There is
a
a
case
slide of
study. Yes, ma'am.
Yeah, please start, sir. No problem.
Sir. Underlying etiology, I will explain in Ayurvedic perspective. This patient is come to us in OPD. He is having causes like stress and mandagni and chronic indigestion. According to Ayurveda, there is Dosha Samarchana. Psoriasis is the mainly Kapha Pitta predominant Vyadi. So we think, according to his symptoms, there is a Pitta and a Kapha dominant. Due to Pitta, there is redness on his skin, and he is also having Ama and Mandagni. After that,
So, sir, can you please
we
explain
have
in detail what is Mandagni? Because there is a crowd of
Mandagni is a chronic indigestion. He is having chronic indigestion problem since 1 to 2 years. And then he is a student having stress also. Then, according to Ayurveda, these two factors are causes kushta. We have done. He has come to us with already diagnosed psoriasis. Uh, we are taking his history as per Ayurveda perspective and treated him as psoriasis. He is a prakriti, that is his uh, Vata and Kapha dominant. When we examine him, he is a ruptured scaly legs, then burning sensation. He is having clinical appearance. We see silvery scales on extensor surfaces. Auspicious sign is positive. Kobner phenomena is positive. Then we think that he is having problems since many years. So we started Ampachan, that is the on digestion, that is Agnidipan with Ampachakwati, because we must correct root cause, that is Ama indigestion. Ampachakwati given him for 7 days. When his digestion is improved, then we started Panchakarma treatment. In Panchakarma treatment, we firstly started Snehapan. In Snehapan, we choose specific drug, Panchatikta growth, because in Panchatikta growth, there are 5 herbal drugs which are acting as a Kushtagna or in psoriasis, which we can say. For local application, we give Zartelitil. Then for when first day, second day, third day, fourth day, we are give Snehapan in increasing dose, that is 30 ml, 60 ml, 90 ml, and 120 ml. After that, Snehaviram is given as per protocol of Panchakarma. On next day, very next day, on Snehaviram, we give Virechan with Trivrutavle because his weight is low weight. So we think that Virechan must be do with proper medicine. After given Virechan drug, there are 90 weeks according to Ayurveda. Then we give proper sunsaline for 5 days. After 5 days, we started विमे आरोग्यवर्धिनीवटी गंधक रसायन and Avipattikar Churna Mahamanjishta Ganavati. These all drugs are acting on psoriasis. Like we see the slide, these all drugs are given in Vanodan and after food with Koshnagel for 15 days. Ayurvedic Churna is given for virechan, that is purgation purpose. After that, we take before and after photos. When he improves his digestion and other things, then there are results you seen in the photo. We seen there are two drugs, Gandhatrasan also given for redness, burning, itching, and thick skin. Inflammation is covered with drugs. Arogyavardhini is removes or reduces accumulation in skin. It is also act as a liver detoxification. Then we also give Mahamangeshtagan.
Please explain Snehan for our audience because they are
Snehan is a procedure with ghee. We will call it the
internal or external application.
internal, madam. It is given in internal in increasing dose.
Okay, and virechan is?
Virechan is a purgation purpose.
Okay,
Because
induced
virechan, induced purgation, sorry. And we got release in one case. This is one case. We will study other cases also. And according to modern, we also think he is taking steroids. We tapered the dose and then started the Snepan. And then started after Virechan, we come given. And then we started this Ayurvedic medicine. He is in follow-up now, up to date.
So, sir, according to your or Ayurveda, is there any limitation or have you faced any limitation during your treatment?
Madam, there is limitation. If diet is faulty, he is not taking proper diet because he is student and he is eating in mess. So that is not in our control.
Okay.
And
And
stress is unchanged. Stress also unchanged.
okay.
Madam.
What about chronic cases?
Madam, chronic cases, we have treated many cases, but results are 50%, not up to the mark. A patient of
So
skin is
result
not in
varies
full.
according
Result varies, madam, according to chronic conditions.
Okay. Okay, sir, thank you so much. Please stay with us.
Okay.
To discuss the homeopathic approach for psoriasis,
Okay.
we have Dr. Vaibhav Mahajan. Dr. Vaibhav
Okay,
Mahajan
ma'am.
is
Thank you.
professor and head of Department of Community Medicine from Dhanvantari Homeopathic Medical College, Nashik. Dr. Vaibhav?
Hello. Yes, ma'am.
Yes, sir. Welcome.
I am audible.
Yes, sir, you are audible.
Yeah. First of all, thank you, ma'am, and all members of the EMHS faculties. Myself, Dr. Vaibhav Mahajan. I am the homeopath and the clinician, researcher, and the teacher. So first, as we know, Dr. Shraddha just tell about the psoriasis little bit, but I will just go through the little bit about the psoriasis and all the points which needed for the homeopathic point of view. First, we understand the psoriasis in the modern way. The psoriasis is now recognized as the chronic immunomediated inflammatory dermatological conditions that is driven by the overactivation of the Th1 and Th17 pathway, and is also having the genetic predispositions, environmental trigger factors like as stress, smoking, infections, cold weathers, metabolic syndromes, etc. The allopathic treatment offers relief, but often carries the limitations like as the toxicity, just sir explained, dependency, and mostly the relapses. This gap is strongly needed for the holistic, safe, and the long-term therapies, and the space where the homeopathy contribute meaningfully. The why homeopathy holds the distinctive role. The homeopathy offers the individualized, miasmatic, and constitutional based approach that supports the immune modulations. Sir just explain about the drug methotrexate. Methotrexate work as the immune modulators. Like the homeopathy medicines also have the immune modulations, reducing the triggering such as stress and emotional disturbances, addressing the comorbidities like psoriatic arthritis, metabolic syndromes, anxiety, etc., promoting the long-term remissions, and enhancing the quality of life without toxicity. This treatment focusing on the patient-centered, not the disease-centered. The homeopathy focusing on the disease patient-centered, mostly not the disease-centered. What we call about the evidence supporting for the homeopathy in psoriasis, the international and national studies, that is several RCTs, randomized control trial from the India, Europe, and UK shows a measurable reduction in PASI scores. The CCRH, Central Council of Research Homeopathy, multi-center studies report improvement in scaling, itching, plaque thickness, and overall well-being. Observation and clinical reports, homeopathy often shows the reduction in flare-ups, longer the remissions, and lower the stress levels, and improve the DLQI score, that is Dermatological Life Quality Index scores. More large scale, the trial are needed, but the current literature also the promising results. Now we are going to the common remedies that which use for the homeopathic point of view. While the treatment is always individualized, certain remedies have a strong clinical indications, like as there are many remedies, but I am telling you the few remedies. The arsenic album, the key indications that are the burning, redness, and the winter aggravations. Graphitis, that is a crack, sticky oozings and thick crust, petroleum, deep fissures and bleeding cracks. Sulfur, like we use sulfur in intense itching, redness, and psoric constitution, like as Kaliar, Kali iode with rapid exfoliation, some stages, they are exfoliating phases. Some constitutional medicine like as Lycopodium, Sapia, Calcarea carbs, based on the emotions and few modalities. Homeopathy never treat the patch alone. It treat the person behind the patch. Some homeopathy philosophy linked in the psoriasis, that is miasmatic background, like as the psoriasis is a multi-miasmatic disease. Psora that denotes the dryness and the scaling. Psychosis that denote the thickened plaques and hyperproliferation. And syphilis denotes the cracks, bleeding, and the destructive tendencies. Organelle principle also holistic case taking, need with totality of symptoms, individualization, potency, repetitions, follow-ups, and many things that needed for the as per the guideline. What is integrated with the homeopathy and the modern medicines? The homeopathy approach contribute reducing the chronicity, preventing the relapses, managing the stress trigger factors, safe for the long-term use. And modern dermatological contribute what the modern medicine contributes, that contribute in the accurate diagnosis, PASI and BSA scores, baseline lab investigation, and management of emergencies, such like as emergency cases like as the erythrodermic psoriasis, arthropathies are present in the psoriasis. Together, we provide the evidence-based integrated. What are the limitations? Homeopathy also has a limitation. A severe psoriatic arthritis may need a particular investigations and the treatment. Some erythrodermic psoriasis needs a medical management because it's covered the more than 90% of the body surface areas. That is little bit what we call it's a emergency conditions. Homeopathy requires the time, patience, and the follow-ups, and the more RCT and biomarker study are needed for the further studies. What are the future direction in view of the homeopathy? RCT using the PASI score, DLQI scores, biomarker researcher. The research should be based on the biomarker research, that is IL interleukin 17, interleukin 23, ENF alpha, like as. Integrative skin clinics in the medical colleges, publishing a Scopus Index dermatological journals, and the digital case analysis and AI assisted repertorization. This homeopathy fits perfectly in the era of personalized medicine because everyone wants the personalized medications. Now come to the conclusion. Homeopathy does not claim to the cure of every psoriasis cases, but it offers something profound, safe, sustainable, and individualized healing. It treats the person, not the plaque. It treats the mind, not just the skin. Treat the root cause, not only the symptoms. In today's world, where the chronic diseases are arising in the patient seeks holistic care, homeopathic stands scientifically grounded, patient-centered, and integrative approach to the psoriasis. Thank you. Thank you, ma'am, and thank you all colleagues and faculty members to listen me for the homeopathic approach. Thank you, ma'am.
Thank you so much, Dr. Vaibhav. I like your sentence that homeopathy never treat the patch alone and it treats person behind the patch, right? So thank you so
Yes,
much for a detailed explanation according to homeopath. So homeopath provides personalized treatment, right? According to
yes, ma'am.
biases
Personalized.
and
Constitutional
signs
medicine.
and symptoms. Okay, thank you so much. So there are certain questions in chat box. So Dr. Sonu is there, and she is asking about a child who is suffering from psoriasis since the age of 6 months. So what can be done in such cases according to homeopath? First, I will ask you.
In 6 months baby, there are difficult to take a mental symptoms, but few symptoms are under observations we can give. Few particular medicines we can use, like as a petroleum 30, okay, or as the mother constitution. Some cases I have seen that the mother nature or mother constitution most help to the child also. If the mother has if the mother is a natramute personality, then natramute medicine will also help the baby for the improvement in his cases. So we need to take a proper case, appearances, or the data which need for the homeopathy, then will definitely help out with the child.
Okay. For Dr. Bhushan sir. Dr. Bhushan sir.
Yes, ma'am. So in a 6-year-old child, there are limited treatment options available. So I think the safest would be a newer molecule, that is a PDE4 inhibitor, which is apremilast. I think apremilast will help in resolving the symptoms very effectively, and it has a very good safety margin profile. However, depending upon the severity of the disease, methotrexate can also be considered, but depends it's a male child or a female child. What are the manifestations? Methotrexate would be a second option, not the first option. I think apremilast will be a good option in her case.
And is this the common scenario or uncommon?
No, pediatric psoriasis is very uncommon. It is not a common scenario that you can see. It is usually seen after an upper respiratory tract infection, like sore throat, pharyngitis, or something like that, or any other viral infection that acts as a triggering factor. And 6 weeks to 6 months later, the patient can present with psoriasis. So, and sometimes comorbidities like vitiligo, alopecia areata, or maybe even what I was going to say, vitiligo, atopic dermatitis can also manifest with psoriasis. Pediatric psoriasis is difficult to treat, but I think the prognosis is better. Usually, they tend to improve after a particular period of time.
Yes. So good news is prognosis is better. So then same question from Dr. Sandeep. Dr. Sandeep.
Madam.
So
For
what?
6-year child, we can
Ayurveda?
give syrup-based medicines. Firstly, we take history of her mother, his mother, during pregnancy, what
So
she
from
eats.
Ayurveda, it will be limited up to medicines, internal
Uh,
medicines, right?
yes,
You
yes,
can
madam,
do
yes.
that like Snehal, Swedan, or Virechan,
No,
right?
yes, yes. Neither we give anything that like we give only local application of growth or oil.
Okay.
Um,
Local application
according to
is
his.
okay. Okay, thank you. Then, is there any another question from audience? You can unmute yourself, or you can write in chat box. So we have another 5 minutes. Any specific diet advice to include or exclude? So Ayurveda, homeopath. This question is for Dr. Sandeep sir and Dr. Vaibhav sir. So
As
Dr.
per homeo, yeah, yes, sir.
Okay. Yes.
Sandeep sir, you can start. I will tell.
हाँ सर, नहीं सर, कंटिन्यू कीजिए आप, मैं बोलता हूँ.
तो सर बोला क्या प्रॉब्लम नहीं है.
A specific diet is there according to his constitution, because all the diseases come from the gut, and we must prescribe diet according to his disease.
Okay.
And in stress, we can give all.
I think
madam.
you are thinking about Prakriti, right?
Yes,
Right.
yes, ma'am.
Okay. And any specific stress, because stress is highly general, non-specific word. Dr.
Yes, ma'am.
Kailas in chat box.
Yes,
He is
we
asking
can
about
treat.
stress. Yeah.
We can treat stress according to Ayurveda with the help of the Panchakarma like Shirodhara or Shirobasti. We can counsel him about his stress, or take inputs from him about his stress, and then we can suggest medicines. Some medicines are there for stress relieving in Ayurveda.
Okay. Okay. So next, Dr. Vaibhav sir, about diet and stress.
Yes, when we go into detailed case taking, so we find out what are the aggravating food entity, time entities, or anything that aggravating the patient's conditions, that we try to remove or reduce it.
But is there
Answer
a key ingredient?
particularly a few some in homeopathy, that not such like as ki some foods should be not taken, but few are there ki non-vegetarians that increase the reduce the protein intake. All these things you should reduce, that increase the inflammatory process in the body.
Okay, okay, okay. And what about stress management?
Stress management, definitely we should find out the root cause of a stress that we need for the, if we need him for the counseling, or some what we call it, lifestyle modifications, like as some medication, meditations, yoga, pranayam, that will definitely help him out to reduce the stress levels.
Okay. Then next same question is there. Any education for patient and family related to disease condition?
Bilkul. This disease is best part is it is a non-contagious disease. Okay. So the family member should counsel about the non-contagiousness, and it will definitely need help. Not only the medications, but sympathy is also required from the family members or close one relatives.
Okay. Thank you, Dr. Bhushan.
Yes, ma'am. I'd like to add one thing. As someone in the chat box said that stress is generalized. Stress is itself is generalized because a stressor factor can be particular to a particular person. For example, some might have a personal stress, some might have financial stress, some might have job-related stress. So you have to identify what particular stress is there in that patient, and accordingly you have to modify that. So that is why stress is used as a general characteristic or a general wording over here. So it depends on the patient to patient. The patient might have different kind of stress. So you have to identify and you have to treat accordingly. And with respect to diet, we definitely tell the patient to avoid red meat, but any kind of other protein intake, for example, boiled eggs or white meat, for example, chicken, is not contraindicated. But red meat, we specifically ask the patient to avoid, and again, alcohol intake is to be avoided. Smoking or any other kind of tobacco consumption is to be avoided. Later on, we ask the patient to increase omega-3 fatty acid, polyunsaturated fatty acid, which act as antioxidants. So avocados or maybe olive oil, dry fruits, that play an important role.
Okay, and is there any education or any message, specific message to patient and family?
Specific message in for this seminar or in general while treating a patient?
In general for psoriasis.
Yeah, no. So psoriasis, the first and most important thing that we counsel the patient that it is a long-standing and chronic disorder, and it is a difficult to treat disorder. And even if with any kind of therapy, even if it goes away, there is a high chance that the patient might land up in relapse. So, firstly, it is very important to counsel and educate the patient about the nature of psoriasis, that it aggravates in winter, it subsides in summer, stresses play an important role, and how long the treatment is going to go on. That is very needed. That is important for the patient, and financial burden of the treatment. That is also an important counseling that needs to be done. And as sir said that it is also necessary that to put forward that it is non-communicable. So it is not going to be, it is non-contagious rather than communicable. It is not going to spread because of physical contact or something like that. So I think that is also important. Yeah.
Okay, and my question is particularly for you, Dr. Bhushan, that what will be your choice for referring your case? To Homeopathic or Ayurveda? Because you have listened both.
Yes. So I think I would leave it up to the patient, I guess. If the patient has not been satisfied with my treatment, I can ask the patient to change the discipline and try either homeopathy or Ayurvedic line of treatment, and help the patient for achieving remission of psoriasis. But I would not directly refer to the patient to a particular discipline. I would ask the patient to choose the discipline as per his choice and then go ahead with that particular treatment.
Okay. Thank you so much.
Yes, thank
Then
you.
next question is for Ayurveda and Homeopathy. How do you decide when patient needs modern medical intervention, that is allopathy, instead of purely Ayurveda management? So this question is for Ayurveda. Dr. Sandeep.
Yes, ma'am. When there is acute condition, patient is not responding to Ayurvedic medicines.
Okay, non-respondent patient, you may refer. Okay, thank you so much. Then each psoriasis causes low HB count. Dr. Samiksha. So Dr. Bhushan may reply for this question.
Yes, ma'am. Psoriasis per se, I don't think that it causes anemia, because the patients of psoriasis do not have any defect with related to erythropoiesis. So maybe, or even if increased destruction of red cells or anything like that. So I don't think psoriasis per se causes anemia in itself. However, being a chronic disorder, anemia of chronic disease might present in some patients, but it is not a direct correlation, I think so.
Okay. Then last question, we have just
Yes.
1 or 2 minutes. How we differentiate psoriasis versus atopic dermatitis?
So atopic dermatitis is usually present in early childhood or in infancy. So if the patient is presenting to you with involvement of skin of the flexural parts, for example, periorbital, neck, antecubital, popliteal, then flexural parts, cheeks in infants, then you can consider atopic dermatitis. And psoriasis is very well defined skin plaques are there. On the contrary, atopic dermatitis is not very well demarcated, and it is usually present on the flexures, and psoriasis is present on the extensors. For example, knees, elbows, scalp, uh, trunk, lower back. So depending upon the site and appearance of the lesions, you can differentiate between atopic dermatitis and age. So pediatric the psoriasis is relatively uncommon, but atopic dermatitis is fairly common in pediatric age group.
Okay, so thank you so much.
Yes, thank you, ma'am.
First, Dr.
Thank you.
Bhushan, Dr. Sandeep, Vaibhav, thank you so much for your
Thank you.
expertise. Thanks to Dr. Shraddha for your case, and thanks to audience for patiently listening. Please suggest your next case studies. You can write us on mail. Our mail ID is ayush@muhs.ac.in. Thank you so much. We are stopping here.
Thank you, madam. Thank you.
Hello, Bindi sir. Hello. सर चॅटला रिप्लाय कराल का प्लीज?